Hi, this is Dr. Kaufman, and what we're going to discuss on this particular video are our brand new stellate ganglion protocols, and we're going to connect those with our highly successful basic 3, basic 4, basic 5 protocols, Vegas 1, 2, 3, and 4 protocols that we've been teaching for many, many years now. We have now updated all our protocols with a new 11-point stellate ganglion protocol, which we're going to talk a lot more about in just a minute. But let's have some pictorial anatomy to visualize exactly what we're talking about. Our basic concept, to sum this up, and this is really powerful and extremely important for many, many people. On a practical level, we've been teaching this, some of these components we've been teaching for free to approximately 800 attendees at our free webinars for the last 2 years now. This is 2022. We started teaching this at the start of the pandemic in 2020. And what we have done is invited healthcare practitioners who have had either lasting post-traumatic stress disorder, chronic emotional stress, pandemic anxiety, pandemic stress due to the pandemic, COVID-19 pandemic. Of course, now we've got World War III on our doorstep with Russian invasion of Ukraine. But basically, what we've done is treated over 800 attendees at our webinars for a few minutes with a very high success rate. I don't have the statistics sitting in front of me, but we've got approximately a 75 to 80% response rate just as an initial survey with 1 5-minute treatment. We have approximately 80% response rate, which more or less parallels my 80 to 90% success after several treatments, going back about 35 years now. But anyway, the basic idea, the big idea is that in many cases, nothing works on everyone, of course, but in many cases, we've demonstrated within a few seconds, really, that post-traumatic stress disorder and many cases of chronic emotional trauma, many cases of phobias, and of course, many cases of vertigo, tinnitus, some other inner ear dysfunctions, and then some cases, or many cases rather, of so-called vagal dysfunction syndromes such as long-term GERD, heartburn, people, severe constipation going back in some cases many decades. Many of these patients have responded with one very simple 3 to 5 minute treatment on our webinars in the last couple of years. Our basic theory is right here that in many patients with those symptoms and others, there is a chronic inflammation that takes place in the inner ear. Now, I touch both of my ears, but it could be on one side or the other or both. But what happens in our hypothesis is that there's chronic inner ear inflammation that takes place, which is accompanied by impaired drainage from the inner ear through the internal, specifically the internal, but also the internal and external jugular veins. This chronic inflammation due to impaired drainage is due to, in our theoretical model, what are called somatovisceral reflexes that exist in the muscle structure, both in the pectoralis muscle structure, in the SCM and the scalene muscles and the trapezius muscles. And there are so-called somatovisceral reflexes that take place that perpetuates and continues long-term inflammation in the inner ear and therefore in the associated structures of the jugular veins, the carotid artery, the vertebral artery in the back, and more importantly, the vagus nerve and the related stellate ganglion and the carotid baroreceptors. So having said all those big words, let's pull up we have a number of different fantastic anatomical models that we can show you here today. So this is, of course, the front of the body. And this, I think you can see all that. So this is the sternocleidomastoid muscle. Here is the brachiocephalic turning into subclavian vein here. I am going to take away the clavicle so you can see underneath that. And actually, I'm going to take away the SCM on one side. So you can see there, here's what the SCM looks like in normal life. And on this side, when we remove it, you can see that right behind the sternocleidomastoid muscle is the subclavian vein, which enters or empties rather into the superior vena cava. Now, in addition, can't quite visualize it here, but you may remember that the thoracic duct gathers all of the lymph from the lowest portion of the body, the lower portions of the body, if you follow my cursor here, and the thoracic duct trains the entire lower body up and then crosses over and drains into the subclavian vein right there. So this whole area right here, which is behind the pectoralis minor, which will bring online the pectoralis major and the pectoralis minor, but you can see there that the pectoralis major to some extent, but that's less of our concern, but the pectoralis minor over here directly, potentially directly impinges on the brachiocephalic vein as it comes up, turns into the subclavian vein, and then goes down there. So theoretically, if there were somatovisceral reflexes in the pectoralis minor, the pectoralis major, the sternocleidomastoid muscle, and then on the back, of course, we have the trapezius muscle, which should be a little more obvious. The concept of somatovisceral reflexes is many years old, 80 years old, I think, something like that. That's been around a while. But basically what we're discussing is the effect of geographical proximity. So you may have muscle structures, myofascial structures very near the venous structure, which because of neurological influences, there are problems in the myofascia. Forget about the fascia for a few minutes, specifically in the muscle function. There may potentially be dysfunctions within the muscles that if those dysfunctions continue for a long period of time, they may perpetuate impairment in circulation in the subclavian vein, which can back up and cause impairment in the drainage of the external here and internal jugular vein here, which then again can cause a backup into the inner ear. And let's switch to a little more direct visualization of the inner ear here. I think we can maybe see that. Maybe we can't. We don't see that. Okay, so we're not seeing the inner ear. Let's pull that up one more time. Okay, so I don't know if you can see this or not, but here, I'll do this very quickly. Here's the inner ear. Very specifically, this is the jugular foramen where these structures exit and enter the skull. And if you can't see this, just listen to me. I think you can see this, but I'm not certain. And then you've got, of course, the internal jugular vein, you've got the internal carotid artery side, you've got the vagus nerve coming out of here. And then lower down, we'll stop the share and go back to our other share. Whoops. Yeah, lower down here at the base of the neck, you have the sympathetic chain. See if I can make that a little more obvious to you there. There you go. Look at that. You've got the sympathetic chain here and the stellate ganglion right towards the root of the neck with the sympathetic chain coming up from the dorsal spine, turning into the cervical branch of the sympathetic chain. So important to know the anatomy there, or at least sort of vaguely understand the anatomy. So what our concept is that when there are visceral somatic reflexes, in other words, when the sternocleidomastoid muscles, the scalene muscles, the pectoralis muscles, when they are not functioning optimally, They are causing an interference with drainage coming from the jugular veins, internal external jugular veins, and that's causing a long-term inner ear inflammation. There's a doctor in New York, White Plains, New York, named Harold Levinson. He's a neurologist, and I've followed his work since about the mid-1980s. And he treats patients primarily with phobias, some patients with post-traumatic stress disorder. He specializes in kids with learning disabilities. He also has some case histories of kids with autism. And he has treated these patients since the mid-80s. He has hypothesized that there is an inner ear dysfunction, chronic inner ear inflammation, as we mentioned, that is causing his patients to have the symptoms that we just mentioned. He treats them with medication and in many cases gets quite excellent results with those conditions. Since about the 80s, I have been treating the same patients using the same theoretical, but instead of using medication, of course, we have developed our pain neutralization procedures, which are designed to immediately and hopefully long-term reduce that chronic ear inflammation by opening up circulation in the subclavian vein, the internal jugular vein, which therefore affects vagus nerve function, the stellate ganglion, and that ideally reduces chronic inflammation very quickly and ideally long-lasting. Now, obviously, not every patient responds, but we now have well over 100 cases just from the people that we've treated in the 800 people on the calls who we've treated in the last 2 years. We have a huge number of people that have responded within a few minutes and have had long-term results from what we're doing. So that's what the anatomy is. That's what we hypothesize is happening in the body. We will teach you some of these procedures for you to use on yourself and to use on your patients. Many of my students use the so-called basic 3 procedures and the master circulatory procedure and some of the other vagus nerve procedures. Many of my students use these on every single patient because many of us are suffering from various degrees of chronic emotional stress and chronic emotional trauma. I have treated just in the realm of post-traumatic stress disorder, I've treated over 1,000 cases since the mid-80s, and our success rate with that is somewhere between 80% and 90%. It's an extremely high success rate and it generally takes place within 1 to 2 visits. Occasionally it takes 1 or 2 visits longer than that to make it permanent. Many of our students, my doctor students, have reported instant, and these are proof of concepts, instant signs of vagus activation from you doing the procedures, including profound relaxation and calm, and immediately increased peristalsis and even bowel elimination, even in patients who have had severe constipation for more than 30, 40 years. In some cases, we've had reports of instant resolution of vertigo, although we have many other vertigo techniques that we use as well. I have had my students monitor their sense of balance by standing on one leg before the call and then seeing how long they can stand on each leg. And then after doing the procedure, seeing how long they can stand on each leg. And in many, many cases, in most cases, when we've done surveys, people can double or more their one leg standing time, which those of you that measure balance understand is a remarkable achievement for a very short treatment time. There has been, surprising to me, because I did not know this when we started teaching this on webinar, but there is very often a resolution or at least a substantial improvement in chronic physical symptoms as well, especially chronic pain, which leads us into the area of the so-called PNT. PNT, pain neutralization technique, is the rubric of all the procedures that I've developed over the last 20 years. But there is a strong pain neutralization technique, PNT, mind-body effect, which seems to take place when we stimulate these somatovisceral reflexes. And it seems that reducing that chronic inflammation in the inner ear and its effect on the proximal structures, again, the importance of proximal geography, or geographic proximity, because that inflammation in the inner ear, once we reduce that with our treatments, which generally takes, as I said, less than 90 seconds, people often report resolution of chronic physical symptoms. And this indicates to me, along with some of the other evidence that we've accumulated, that there's an immediate effect on the vagus nerve, there's an immediate effect on the stellate ganglion, immediate effect on carotid baroreceptors. Right now, I have a patient who was concerned about somewhat elevated blood pressure. It was only 140/85, which is certainly not malignant hypertension, but this patient generally runs lower, much lower blood pressure, something like 110/65 or so, and she was quite concerned. So it had been elevated for a couple of months. We taught her a very small part of the new stellate ganglion procedures, and her blood pressure immediately dropped down now to where it had always been before, to a normal level. As you may know, the stellate ganglion is treated medically by injection, and there are a number of effects from that. It's treated in patients for PTSD. It's treated for patients with shingles, with chronic pain. One of the many things that can perpetuate chronic pain is hyperactivity of the sympathetic nervous system, hyperarousal over a long period of time. So treating the stellate ganglion is proposed in many of these people to help to calm down the sympathetic nervous system. However, it does involve injection right here into the front part of the neck, and understandably, people are not really too keen on having that done. Anyway, our procedures, our new stellate ganglion procedures, which I probably will teach one or two at the free webinar, and I will teach many of them. It's a 10-point protocol, but we'll be teaching many of them at the upcoming weekend seminar on June 11th and 12th, 2022, which is where we are right now. You may be watching this 5 years from now. We don't know. But our stellate ganglion procedures are completely safe. There doesn't seem to be any danger of a side effect if you do it correctly, because all our contacts, of course, are very minimal. And in addition to the other aforementioned improvement in various symptoms, many of our patients, or students rather, on our previous calls have had a dramatic improvement in their ability to turn the neck and their degree of cervical rotation. I will not get into how important the cervical column is and the importance of maintaining as much cervical rotation as you can through the period of life. As you easily can see, people as they age lose their ability to rotate their neck. Generally, senior citizens have a much more limited range of motion than younger people. And I believe this accumulation of trauma in the neck over a lifetime is one of the very main things that produces these so-called somatovisceral reflexes that not only can we clearly see with an inability of people to rotate their neck, but the other symptoms that are due to somatovisceral reflexes in the neck, which is interference with proper stellate ganglion function, interference with the carotid baroreceptors, and interference with vagus functioning. Carotid baroreceptors, as you probably remember, are responsible for maintaining normal blood pressure. And if they're not functioning properly, if they detect, one of the things that can go wrong with people as they age, of course, is the blood pressure increases. And one of the systems in the body is designed to monitor that is the carotid baroreceptors. So that's the short version of that. So in addition, we have to the other effects that we see very, very often, we see marked instant improvement in cervical rotation, as much as 20 degrees, 30 degrees, and some people even double or triple their cervical rotation after doing these simple stellate ganglion and vagus procedures. So a few more notes on this, and then we'll be done. I tried to make this brief. It doesn't matter how long the conditions have been present. Now, as I say always, not every patient will respond to our procedures, but it is shocking how many people do respond. But it is not a question of how long they've had it. Even if a patient has had post-traumatic stress disorder for 20 or 30 years, or if they've had vertigo for many, many years, if they've had ringing in the ears, tinnitus. We've had dozens of cases of tinnitus, ringing in the ears, that have responded after one treatment using our vagus protocols. It doesn't matter how years they've had the problem, they may well still respond to treatment using these procedures. Doesn't matter how severe the problems are, and it certainly doesn't matter how many other doctors they've been to, because if they haven't tried these particular techniques, then they haven't tried relevant protocols. They may have tried medications, they may have had surgery, they may have vagus nerve stimulators, they may have had chiropractic acupuncture and everything else, but they won't have had specific pain neutralization techniques applied specifically to immediately and hopefully long-term remove so-called somatovisceral reflexes in the associated muscles. So I think we've said most of, I think I did say the stellate ganglion protocol. It's about 12 different techniques now that make up the stellate ganglion protocol. Just a quick review, overactive sympathetic nerve activity, which is what we're aiming to calm down. In fact, we call the stellate ganglion procedures calming procedures because that's the effect that so many people report. One thing to keep in mind is that the stellate ganglion procedures by themselves may not do the whole job. But what happens is the stellate ganglion procedures remove the block to improvement in the venous circulation in the subclavian vein and the jugular veins. So if the basic three and the master circulatory procedure and the vagus technique don't have a full effect, which most people they do, but some people you do the vagus techniques and the basic three and it's not as powerful on them as it is on other people. One of the reasons for that is that the stellate ganglion may be irritated by somatovisceral reflexes in the neck muscles, and that irritation is interfering with the effectiveness of our basic three and vagus protocols. So we do the stellate ganglion procedures first to remove that irritation. And having done that, it's full speed ahead. We open the throttle. Then we redo the basic three, the master circulatory procedures, and the vagus nerve procedures. And in my experience, and the experience of some of the doctors who we've taught preliminary versions of these techniques, the basic three will be much, much more powerful. And the vagus techniques will be much, much more powerful after we do the stellate ganglion procedures. So to recap, excess or hyperarousal or excess sympathetic nervous system activity may be what's causing patients to have chronic post-traumatic stress disorder, chronic emotional trauma and stress, traumas and thoughts that happened many, many years ago that people are still fixated on and can't get past. Somebody died, somebody left them, somebody divorced, they had a financial collapse, they had a major illness like cancer. Years later, people are still traumatized by this. We all know people like that, and many of us have these kind of trauma. And our experience with getting rid of these in a very, very short period of time with no talk therapy involved whatsoever, no medication involved whatsoever, has just been outrageously successful. So people with chronic anxiety states or depression, in some cases, not all, people with chronic sleep disturbances or acute, people with various digestive dysfunctions, especially where it seems that the vagus protocols, vagus nerve rather, is not working as well as it should to modulate digestion and excretion, including chronic constipation, chronic burn and GERD, gastroesophageal reflux disorders, chronic and acute pain of many kinds respond to these procedures. Elevated heart rates like tachycardia, always, of course, making sure that any medical condition that needs medical treatment has been ruled out always. And then, of course, more obviously, head and neck pain, trapezius pain, shoulder pain, vertigo, chronic inner ear disturbances, which may reflect in vertigo, also tinnitus and ringing in the ears. As I mentioned, there are probably some cases of hypertension that will respond very, very well to these procedures. We don't know how many yet, but we'll probably find out as we get more input from our doctors. Visual disturbances and auditory disturbances. We have quite a number of doctors who have reported now cases of people with long-term hearing loss that has responded to the vagus protocol, specifically vagus release 1 and 2. And we expect when we do the stellate ganglion on those initially, vagus 1 and vagus 2 will become more powerful and give back or improve hearing on more patients as we go along. So we have, as I said, over 100 different testimonials. We have about 13 pages of them here, but to keep this brief, hopefully we'll have read some of the documents that we sent out with this. So that is a summation of our new stellate ganglion procedures, and I'm very excited to hear your results after you've learned them. Thanks very much. And please, as always, send me your results. Do not be lax in that. That is how these all came into play, is by my hearing the results of my students. Thanks very much.